Hello and welcome once again to another interpretation of ECG. Today we are looking at the cardiac axis, but if this is the first time you are watching this, I will encourage you to go back and watch the previous videos where we described in detail how to determine the heart rate of an ECG as well as the rhythm of an ECG. And so when we say cardiac axis, we are trying to describe the direction of impulse flow as well as depolarization through the heart. As we know already, impulses are generated in the sinoatrial node and they spread to the AV node through the bundle of His, then to the bundle branches and eventually to the Purkinje fibers, which cause the contractions of the heart. And so when we look at the heart from the frontal plane, we can see that impulses are flowing from the 11th hour to the 5th hour as the arrow is pointing over here. Sometimes, however, we may find deviation in this cardiac axis. And so we may have, either being deviated to the right or to the left. And so in right axis deviation, what do we find? We find out that there is usually increase in the muscle fibers of the right side of the heart. And so what happens is that the wave of contraction deviates towards the right side of the heart, since the muscles are increased, and so they need more impulses to cause them to contract. And so when we look at the ECG, what we find is that the QRS complex will be more negative in standard lead 1 due to the fact that very little impulses are reaching it. And we also find that there are more impulses going towards AVF, and so we are going to find a positive QRS complex in AVF. This right axis deviation is usually seen in people with pulmonary conditions such as pulmonary hypertension, and so there is always a lot of pressure on the right side of the heart. We may also find it as a normal finding in very tall individuals. And so as the arrow is pointing, if it is right axis deviation, you may find the impulses being directed towards the right side of the heart. Now in left axis deviation, we usually find it when there is delay in impulse conduction, as we find in left bundle branch block, and sometimes also we may find it in left ventricular hypertrophy. So what happens here is that the general direction of depolarization is deviated to the left side of the heart. And so when we look at the QRS complex, we find that there is a negative QRS complex in AVF and a more positive QRS complex in standard lead 1, since more impulses are going towards that direction. Now, we may also have extreme axis deviation, and this extreme axis deviation is usually found in people with ventricular tachycardia, sometimes also in hyperkalemia, and also in severe right ventricular hypertrophy. We may find extreme axis deviation in them. Now, how do we determine the cardiac axis? There are a lot of methods that we use to determine this, but I'm going to describe only 2 of them over here. And so when we pick the ECG, we use the QRS complex in determining the cardiac axis, since it represents the ventricular contraction or depolarization. Now we have the quadrant method as well as the 3-lead method that I'm going to describe over here. So when we pick the quadrant method, what do we see? In the quadrant method, usually we focus only on standard lead 1 as well as AVF. Now, before I go in to explain what we find in the quadrant method, I want to describe something small on this diagram over here. Now, In this diagram, as we've already learned, that impulses are flowing from 11 o'clock to 5 o'clock. We see that impulses are flowing towards standard lead 1 as well as AVF. And this is usually the normal axis of the heart, usually. Now, anytime impulses are flowing towards a lead, it produces a positive QRS complex, as you can find over here. And anytime impulses are flowing away from a lead, it produces a negative QRS complex in that particular lead. And so, when we find negative and positive QRS complexes in a particular lead, it gives us so much information. And so, if the QRS complex is positive in standard lead 1 and AVF, as we can see over here, it means impulses are flowing towards standard lead 1, and so we are going to have a positive QRS complex over here. And impulses are flowing towards AVF, and so we are going to have a positive QRS complex in AVF, as you can see over here. And this will form a quadrant. And so the quadrant which is going to form here is the normal axis of the heart. Now, if we have QRS complex being negative in standard lead 1, but being positive in AVF, then what it means is that there is impulse flowing away from standard lead 1, and so we are going to have a negative QRS complex in standard lead 1. But since the impulses are flowing towards AVF, we are going to have a positive QRS complex in AVF. And so the quadrant which is going to be created over here is this quadrant, which is the right axis deviation, possibly pointing towards right ventricular hypertrophy. Also, if QRS complex is positive in standard lead 1, meaning impulses are flowing towards standard lead 1, as we've seen already, we are going to have a positive QRS complex in standard lead 1. But if impulses are flowing away from AVF, it means we are going to have a negative QRS complex in AVF, as we see over here. And the quadrant which is going to be created will be the left upper quadrant, pointing towards to a probable left ventricular hypertrophy. Now, finally, if the QRS complex is negative in both standard lead 1 and AVF, what it means is that the impulses are running away from standard lead 1, and so we are going to have a negative QRS complex in standard lead 1 in the first place. And since impulses are also running away from AVF, we are going to have a negative QRS complex in AVF. And the quadrant which is going to form is going to be this quadrant, which is the extreme axis deviation. And usually, as I explained before, we may find this in patients with ventricular tachycardia, hyperkalemia, and also in severe right ventricular hypertrophy. Now, I'm going to give you clinical examples to make this whole thing make sense to you. In this first example, I will want you to focus your attention only on standard lead 1 and AVF, since we are dealing with these two leads. What do we see on standard lead 1? We find that there is a positive QRS complex in standard lead 1. And in AVF, there is also a positive QRS complex in AVF. So you can pause this and try and see if you can find the answer to this. Now, as we've explained, anytime we find a positive QRS complex in standard lead 1, it means impulses are flowing towards it. And if you find a positive QRS complex in AVF, it means impulses are flowing towards it. And so the quadrant which is going to form will be the normal cardiac axis of the heart, as we saw previously. In the second example, what do you see? You can pause it and try and see if you can do this by yourself. Look at standard lead 1 and AVF. What do you see in them? We see that the QRS complex is negative in standard lead 1, and also it is positive in AVF. What does this tell us? This tells us that the impulses are running away from standard lead 1, and so we are going to have a negative QRS complex. And the impulses are flowing towards AVF, and so we are going to have a positive, QRS complex in AVF. And what quadrant are we going to get over here? We are going to get a right axis, quadrant or right axis deviation in this. Let's look at more examples. In this other example, what do you see in standard lead 1 and AVF? You can pause it and just look at it. In standard lead 1, we find out that there is a positive QRS complex, and also there is a negative QRS complex in AVF. And what does this tell you? This one tells us that there is a left axis deviation pointing to a possible left ventricular hypertrophy. In this other example, what do we see? This is a bit, interesting. What do we see? We find out in standard lead 1 that there are a lot of negative, QRS complexes. Then we go to AVF and we also find a negative, QRS complex in AVF. And what does it tell you? It tells you that all the impulses are running away from standard lead 1 and also from AVF. And so the quadrant which is going to form is going to be the right upper quadrant, which is an extreme axis deviation. Now, let's move on to the 3-lead method. In the 3-lead method, it's quite simple. Now, what we usually look for is there must be a positive QRS complex in standard lead 1, lead 2, and AVF. Anytime you have a negative QRS complex in standard lead 1, but a positive QRS complex in AVF, we are talking about a right axis deviation. And so in this diagram, what do you see? We find out that in standard lead 1, we are having a negative QRS complex. But if we look at standard lead 2, there is a positive QRS complex, and also in AVF, there is a positive QRS complex. So what does this tell us? This gives us a clear indication of a right axis deviation. Also, in left axis deviation, we are going to find a positive QRS complex in standard lead 1, but we may find a negative QRS complex in standard lead 2 and AVF, as we can see in this diagram. In lead 1, we have positive QRS complex, but in standard lead 2, we have the QRS complex pointing down the isoelectric line. And so we say this ECG points to a left axis deviation, possibly a left ventricular hypertrophy. So, what have we learned so far? What we've learned is that whenever there is a positive QRS complex in standard lead 1 and a positive QRS complex in AVF, then we have a normal cardiac axis over here. When we have a positive QRS complex in standard lead 1 but a negative QRS complex in AVF, then we have the left quadrant or left upper quadrant, and so we are going to have a left axis deviation, as you can see over here. And when we have negative standard lead 1 and a positive AVF, then we are going to have a right axis deviation, as you can find over here. Then also, when both lead 1 and AVF are negative on the ECG, then we are going to have an extreme axis deviation, usually found in ventricular tachycardia as well as hyperkalemia. So this is all that I have for you. Thank you very much for your time.